And welcome back. I'm Mabel, Jong. You're watching live coverage of WHCC TV here at the World Healthcare Congress in Washington, D.C. Thank you so much for joining us. In our studio right now, Latecia Engram, who is with U.S. Health and Human Services, and she's the lead of ReImagine HHS. Latecia, so great to see you today.
Thank you for having me.
Well, that title, ReImagine HHS, that leads me to believe that you're in a reinvent yourself period right now. Can you expand on that a little bit?
Absolutely. So about 2017, the Department of Health and Human Services sought a priority to begin to reevaluate its current strategic plan. So about every 4 or 5 years, we set our objectives. We look at what we've accomplished. We report on those annually and our progress towards that. And so this new strategic plan for fiscal year 18 through 2022 is actually a new way of looking at not only where we're going, but also looking at those challenges and how we can continue to be efficient and effective stewards of HHS dollars, the people that we serve, and also improve our delivery to the American public.
And how big a piece is data and really realizing the value of data?
Oh, data is woven throughout the strategic plan. It is in multiple objectives. When we're looking at particularly technology and data, there's a distinct conversation, but the majority of the objectives are how do we use this information? The work that has been done through our programs, through the persons, the initiatives, the special initiatives, our partnerships with other state agencies, other federal agencies as well, to really move the needle forward. And what are we doing? How far have we come? And what are we going to do next? So the work is transformative now, not only looking at the data itself from the program perspective, not in terms of widgets, but in context. So what does it mean to have a certain number of hypertensive throughout the nation? How does that match up with our Healthy People 2030 goals? So the work is really about contextualizing it, and that's throughout everything that we're doing. Evidence-based policy making has been in the making for the Department of Health and Human Services for some time. And the Evidence-Based Commission actually looked at several unique use cases in the Department of Health and Human Services to bring and to show why data is so important and so critical. So we're just continuing to move that forward and also looking at how that impacts the work and the people that we serve. How
quickly can this federal department move on information that you know?
The information that we know, a lot of it is continuously moving. It's never not moving, which makes that a very interesting case. Our programs we have capital investments, we have worked in inventories and programs to support not only the data itself, but really about the programs for the people that we serve. So it's never about we're being stagnant or that there's not an opportunity that we're not aware of. It's how do we enact that and what policies or review of existing initiatives do we need to evaluate to see how to move those things forward.
How actively are you gaining the perspective of people outside the government to help you with issues that you're really trying to address?
So one of the critical aspects of the Chief Technology Office is to support our reframing and review of existing issues by including the outside perspective. Dr. Siddiqui in particular, who is the executive sponsor for Data Insights Initiative through ReImagine, has, she along with the Chief Technology Office, Ed Simcox, who is our chief, not only our CIO, but also our Chief Technology Officer, are constantly engaging in pushing us to make certain that we have an outside perspective, because that outside perspective not only fortifies our validation of what we might see, but it also takes us into a new area, particularly around innovative partnerships that we may not have forged before, and especially around startups. Startups who have a new perspective on things, how are we engaging with them? There's multiple programs in the Chief Technology Office that push us out into the community so that we can constantly engage, and that also includes national associations and in industries and business as well as the private sector.
Can you give me an example of what innovative partnerships have grown out of this initiative?
So actually, yes, I will. I will talk about this tomorrow, but Stanford Medical X, which was the hackathon, they actually led our work around the the Codathon, and the symposium, as well as some other meaningful partnerships. How do we look at this problem? That was something that had never been done before. The event itself, which happened in December 2017, we're still reaping the benefits from that. We invited industry partners. There are at least 70 partners, some very high-level names. Most of them are businesses that are in the tech space, but we invited them to participate and actually help us look at what might be gaps or challenges, or making certain that we've actually gotten the problem right. And so those have manifested themselves in multiple programs now that have sustained things that were unimaginable a year ago. They have now been put into action. One of them is the Google Take Back program for disposing prescription drugs. So those are the types of exciting industry partnerships that's one example, but there are so many more that I think at the granular level within a department, within a program, they're constantly being sought out. There are numerous organizations and nonprofits, but also our grantees in the Department of Health and Human Services constantly bring us information back about challenges that we need to address from their perspective, from the front line of service delivery, and also from research.
And what would you want innovators to know in terms of how to work with your department, in terms of speed, on how things move, or needs that need to be addressed?
The speed is relative to having a clear vision about making certain that we're in agreement about what the need is. And sometimes being able to push the envelope. There are disruptors and risk takers inside the federal government that want to see a new way of doing things. And so part of that is, where's the agreement? Have you gotten to the right office? And that might be our role, is to connect with partnerships, develop other persons or other leaders that may not be aware. And Chief Technology Office is only one of those agencies that does that work. All of our agencies, the 11 operating divisions and the staffing divisions, are constantly engaged in what that might look like. The speed of innovation happens for the government. There's something magical about our process, because ultimately whatever we do, we want to be able to demonstrate its value, not only to Congress but really to the American people. And so that means that we have very concerted efforts to engage the right people in our discussions, to ensure that we are aligned with policy, because we are the federal stewards not only of the government but of the programs, and making certain that the best scenarios are evaluated. So, and also, as much as we can actually look at each case and figure out, is this the best way to go in the path? And that does take a little time. But once we're committed, it's an agreement that's really going to fortify the work of HHS as well as the businesses that we're working with.
All right, Latecia, may I ask you, how was the conference so far?
The conference is amazing. We heard some wonderful conversations this morning about value-based care, and the change management aspect, the philosophy of the people that you're working with, which is part of the cultural norm of any change that's involved and any innovation is really magical. So hearing those sound bites this morning from the speakers was absolutely amazing. It validated the work that we're doing in our office, in the Chief Technology Office, and really what's going on across the government.
All right, Latecia, thank you so much for your time today. Really appreciate it.
Thank you.
And thank you for tuning in. Stay with us.